Today is a huge day in the fight against the coronavirus. American healthcare workers on the front lines are now being vaccinated. But this comes as the country passes 300,000 COVID deaths. Hello, everyone. I'm Kelly Eckerman. A critical care nurse in New York City is among the very first people in the U.S. to be vaccinated. Sandra Lindsay works at Long Island Jewish Medical Center in Queens. Lindsay says it didn't feel any different than any other shot. Now, we know those ultra-cold vials of vaccine arrived here in the metro before noon today, and we have coverage on both sides of the state line as the distribution is already underway in both Kansas and Missouri. And we begin with our Michael Mahoney at Truman Medical Center. Michael?
Kelly, the CEO of Truman, Charlie Shields, says their first shipments of the vaccine got here early this morning. This afternoon, an intensive care unit nurse, Sarah Keel, got the first vaccination here at Truman. One small shot, one big step.
It feels like a little bit of hope, a little bit of light, a little bit of chance that we might start to see some healing.
Keel has worked in the ICU COVID unit since the start of this. The first doses arrived at Truman early today. They won't say how many they have, and they expect to get resupplied weekly. Residents of long-term care facilities and healthcare workers dealing with COVID directly are at the top of the list.
So those would be your emergency department folks, people working in the ICUs related to COVID, on the floors related to COVID. So those would be the first to receive the vaccine.
And to protect against any serious side effects, taking out frontline workers, the vaccinations here will be staged.
We plan on staggering the vaccine and obviously trying to give it to our employees at the end of a series of shifts that they might work, so that we can account for those who may end up having some side effects.
One of the common side effects during testing were fatigue or sore muscles a day later. Missouri expects to get 51,000 doses in this first shipment. In the second wave, the state plans to vaccinate first responders and other critical workers, millions of Missourians. But those vaccinations won't start until sometime in January at the earliest. Now, Keel says she didn't know that she was going to get that first shot until she showed up for work today. And she said as it was being administered, she thought about the many COVID patients that she had worked with over these months, including a few that did not make it. As a Kansas City intensive care unit nurse here at Truman becomes one of the first people in our area to get the COVID-19 vaccine. Michael Mahoney, KMBC 9 News.
On the eastern side of the state, within the last 2 hours, hospital workers started getting vaccinated in St. Louis. At Mercy Hospital, frontline workers who have direct contact with COVID-19 patients are getting the vaccine first. Now, that includes nurses, doctors, respiratory therapists, and those working in housekeeping and nutrition services. The shots have begun in Kansas as well. 5 employees received the first vaccinations at St. Francis Hospital in Wichita this morning. They included a critical care nurse, a housekeeper for a COVID-19 unit, and a respiratory therapist. In KCK, the University of Kansas Health System is a storage site for the vaccine, which has to be kept extremely cold. Doctors hope to get a shipment today or tomorrow from the state and start vaccinations soon after that. But they acknowledge we still have a long way to go in this pandemic.
I think when the numbers start going down and our hospital staff can feel life returning to normal, that's when the real celebration starts. The vaccine is a symbol of hope that will protect our staff and ultimately our community from getting COVID-19. So vaccination is about both science and it's about hope. And I think both are really important.
Now, it's not just healthcare workers in the metro's biggest hospitals. Employees at nursing homes, doctors' offices, and healthcare clinics are anxiously waiting for their vaccines as well. KMBC 9's Bianca Beltran is joining us live now outside KU Hospital with an update on the COVID-19 vaccine distribution in Kansas. Bianca?
And employees at many of the local hospitals here in Kansas will be among the first to be vaccinated over the next couple of days. But other health providers tell me that their vaccine distribution plans depend on the allotment of vaccines that they receive from the state. As the first shipments of COVID-19 vaccines make their way to Kansas, health providers are ready to get started.
I know everyone is very anxious, and we've gotten a lot of calls, when is it my turn? How am I going to get the vaccine? And everybody just kind of hang on and please be patient.
The state expects to receive 24,000 doses this week, 150,000 by the end of the month. The first to receive the vaccines will be healthcare workers and long-term care residents. Johnson County's Health Services Director says staff are drawing from their experience with the H1N1 vaccine, prioritizing those most at risk with distribution plans based on supply.
But it really depends on how much is being distributed around to the states. So 1 week it could be a lot, the next week maybe it's down a little bit, the next week it's up, it's up. Again, it's similar to H1N1 when we never knew how much we were getting from week to week.
It will be a few months before the vaccine is available to everyone.
Continue to wear your masks, be aware, social distance, stay home if you're sick, if your kids are sick, don't send your kids out, and just be patient because the vaccine will be here.
And we also checked in with Wyandotte County's health department. A spokesperson tells me that they are expecting to receive their allotment of vaccines later this month, but their priority is in line with the state, focusing on those who are at the highest risk of exposure to COVID-19. Reporting in Kansas City, Kansas, I'm Bianca Beltran, KMBC 9 News.
When you get your first of 2 vaccinations, you will also get a record card. It will be used to keep track of the shots and help those administering the vaccine. Everyone will be issued the card. It will also tell them when their next dose is due. Now, it will be months before everyone can get vaccinated. Even the CEO of Pfizer says he's not sure when he'll be able to get the shots.
No, I haven't taken it yet. And we are having an ethical committee dealing with the question of who is getting it. Given that there are very strict allocation rules that the CDC has voted, we are very sensitive not to cut the queue and have people getting vaccinated before.
Canada has administered its first doses of COVID-19 vaccine. 5 frontline workers in Ontario are among the first Canadians to receive the vaccine at one of Toronto's hospitals. 3 personal support workers and 2 nurses. Ontario received 6,000 doses of Pfizer's COVID-19 vaccine Sunday night and plans to give them to about 2,500 healthcare workers. Now, as the vaccinations begin, the COVID cases are falling in both Missouri and Kansas. Missouri is averaging 3,700 cases, while Kansas is seeing 4,700. The positivity rate is falling as well. Missouri is at 17.8%. The state of Kansas is down to 16.1%.